Hello everyone, welcome to this another podcast. I am Ranjan Dhar, co-founder of Nibble Foods. We manufacture healthy snacks called aneklavya mixture made of roasted nuts and seeds. You'll find the description and links for our products in our in the podcast description and also in the pinned comments. So today I have the honor and privilege of hosting Dr. Rupesh Bokade with us today, who is head of emergency medicine and consultant critical care at Kingsway Hospital, Nagpur. With over 8 years of experience in emergency medicine and critical care, he has won many accolades in newspaper publications and saved countless lives throughout his emergency and critical care career as a doctor. His qualifications are phenomenal, with degrees and fellowships in MBBS, DNB Emergency Medicine, IDCCM from Indian College of Critical Care Medicine, MRCEM, United Kingdom from Royal College of Emergency Medicine, London, American Heart Association Certified Instructor for ACLS and BLS, Advanced Trauma Life Support from American College of Surgeons, AIIMS Advanced Ultrasound Life. You can see his qualifications and degrees are absolutely exceptional, and I'm very delighted and honored to have him with us today. So welcome, Doctor.
Thank you, Ranjan.
So, Doctor, just to start, since you are dealing with the emergency care and critical medicine, so it will be apt only to start with a few rapid fire questions. So you can answer it in yes, no, or maybe, or in one sentence as you feel, right? So first question to you is quick decision making crucial in emergency care?
Yes.
Is CPR always successful in reviving a patient?
Not always successful. It depends on how quickly you diagnose that patient is requiring the CPR. And if high quality CPR is given within the time, definitely the outcome is very good.
Okay. So do you rely on technology for most diagnosis in emergencies?
Not always 100% rely on the technology, but definitely the clinical skills, the bedside clinical examination, along with the technology, then definitely the diagnosis becomes the reliable.
Okay. So as a doctor, can emergency care be emotionally draining?
Yes.
As a doctor, can adrenaline affect judgment or during emergencies?
Yeah.
Okay. Uh, Doctor, am I audible?
Yeah, you're audible now.
Okay. All right. So I'll begin with our. So did I miss anything in your introduction? If you want
No,
to
no,
add
no.
anything?
It was a very good introduction. Thanks for that.
Okay. So doctor, help us understand your day-to-day activities. How do you deal with it in your profession? What is it all about?
Okay. So basically, I'm an emergency medicine and critical care physician. Okay. Uh, I look after the emergency management. Whenever there is a critical patient who require emergency care, those patients diverted to the emergency department.
Mm-hmm.
So on the basis of their need, we triage the patient. Okay, there are three categories of the triaging, like red, yellow, and green.
Mm.
So most serious patients are triaged into the red category, red zone. Okay,
Yeah.
there are specific beds for allotted for that, specific technology according to their needs, and the manpower also, the trained manpower allotted to that zone.
Mm.
Then it comes to the yellow zone, which are less critical as compared to the red zone, but definitely they are also the critical. And then comes to the green zone, which are walk-in patient. Those require just a supportive management.
Okay.
Okay. So accordingly that we triage the patient and we treat the patient. So many of the patient like trauma patient, polytrauma patient, accidents patients, the liver failure, the heart failure, the kidney failure patients, respiratory failure, ARDS patient, those require immediate attention and life-saving treatment. Okay, these are the patients we generally cater in the emergency. Some kind of patient who require timely management, like we can say the heart attack. Okay, we have to diagnose the patient. We have to take the patient to the cath lab as early as possible for the rescue angioplasty. Then comes to the stroke patient, the brain stroke patients. Okay, so many of the brain stroke patients require timely management, like they have to be thrombolized, they have the blood clot in their brain. We have to dissolve it as early as possible within the 4.5 hours of onset of the symptoms. Okay, so these are the time critical situations where we have to act swiftly.
Right, right. So,
Yeah.
given all these emergencies, so what are the most common emergencies that you face in your day to day?
So trauma is something we are facing day to day. Okay, there are many patients who are suffering from the road traffic accidents, uh, which have multiple injuries like brain injuries, head injury, chest injuries, the abdomen injuries. In the abdomen, there is a liver laceration, blood in the abdomen, shock. Okay, the hypovolemic shock, those require the blood transfusion as well. Then secondary, we also deal with the sepsis. Many of the patients who come in the sepsis,
Okay.
there might be the various reasons. Sepsis is the infection, okay, which has spread throughout the body by blood. So there might be the pneumonia, okay. There might be the urinary tract infection. There might be the abdominal infection or the skin and soft tissues infection, which lead to the fulminant sepsis.
Okay.
Another strata of patient which we cater are the tropical infection. Tropical infection, matlab, like dengue patient, the malaria patient, the chikungunya patient. This is seasonal variations. Okay, generally after June and July, in the rainy season, generally they spread very well, very drastically. Okay, and it is a viral infections, so they spread more rapidly.
Okay.
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 These kind of patients, which are the majority of chunk. Apart from that, the chest pain, the heart attacks, and the stroke, these patients also contribute to
Right.
significant number.
Right. You mentioned physical trauma patients, I mean, are mostly common, right? Which includes road accidents and all. Do you also get patients related to mental trauma who has caused harm to themselves through mental illness or something like that?
Yes. So self-inflicting injury, like suicidal tendencies, these kind of patients also come to the emergency. Okay. Uh, they are very special population to us. They are special patient to us also. And they require special attention. Okay. Not in term of the clinical management, but also the emotional support. Okay. They require counseling. Okay, they need to be heard. Okay, what they are going through, what is the trigger factor for doing such self-harm injury and going to such extreme level. Okay,
Okay.
um so psychiatric counseling in such patient, we involve the psychiatrist as well, the psychologist as well, the counseling. We take care of the acute condition like agitation, okay, or some delirious things. Okay, if the patient is not in the uh, acute state or the present state, then we have to give some medications, even the IV injectable medications as well.
Okay. Okay. Okay, so in case of the physical trauma patient, so I mean, what is the window or how critical or important it is to treat them within a certain window? So, for example, you mentioned there could be clotting of the blood in certain areas of the body, right? So, how critical does it become in those
So
situations?
we see the trauma per se, okay, the road traffic accidents.
Hmm.
There is a concept called as a golden hour approach.
Okay.
So what is the golden hour approach? Golden hour approach is the initial few hours of the trauma patients. Okay. If we treat such patients very well, then the outcome is very good. Okay. Patient survival chances has improved drastically if we given appropriate and timely treatment in that golden hour. Okay. So many of the patients who got road traffic accidents, they have hypoxia, that is low oxygen level.
Hmm.
They have head injuries. Okay. there are chances of aspiration, okay, the blood or the ometers into their lungs. So in such patient, they may require endotracheal intubation and put them on the ventilator. Okay. Many of such patients are hypovolemic, like the blood pressure is very down. Okay. In
Mm.
such patient, there is a blood loss on the site as well or the internally as well. Okay. So that patient need to be resuscitated by the IV fluid. Even after giving the IV fluid, if the blood pressure is not coming to the normal range,
Mm.
okay, that is at least between above the 110 or 20 mmHg systolic blood pressure, then they may require the blood transfusion.
Mm.
Okay, so treating the shock, treating the appropriate hypoxia,
Mm.
applying the oxygen or the ventilator whenever required. Secondly, if there are multiple injuries like bone injuries, the fracture, multiple long bone fractures, okay, in such patients, stabilizing the fracture is also one of the challenge, okay, giving pain management, stabilizing the cervical spine, as we can see in the neck. There
Mm.
are many patients who has a head injury and internally there is a cervical spine injury. Okay, so the chances of missing the cervical spine injury in bleeding patient is very high. So we have to do the CT scan, whole body, so we can see if there is any missing fracture or any missing injury to the internal organ,
Mm.
and we have to shift in such patient, we have to shift the patient to the operation theater as early as possible so that we can stop the bleeding internally.
Okay. 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 And you mentioned on the heart attack and stroke patients also, right?
Yeah.
So what is, I mean, what are the most common causes that you have found that has led to that heart attack? And is the age group young or the age group old, or is it mixed?
So, Ranjan, what we are seeing nowadays since last couple of years,
Mm-hmm.
we are seeing the young populations, okay,
Mm-hmm.
those who are suffering from the heart attack or the ischemic heart diseases, okay.
Mm-hmm.
So what is the causative factor, as you rightly mentioned? What is the etiology? What is the risk factors? So mostly the alcohol, the tobacco, okay, uncontrolled sugar like diabetes,
Mm-hmm.
early hypertensions, okay. Then comes to the this thing, the high risk factors like um, age also.
Mm-hmm.
Okay. Sometime the old age group having the uh, diabetes, hypertension, dyslipidemia, that is a higher cholesterol levels. Okay.
Mm-hmm.
These patients are also at the higher risk.
Mm-hmm.
Sometimes it's also runs in the family as well. Those patient who has a family history of ischemic heart disease or the sudden cardiac death.
Right.
Okay. Those patients are also at the higher risk. Even nowadays, there is a stress factor also.
Mm-hmm.
Those who are continuously under the stress, they have the higher chances of undergoing such diseases or having the cardiac arrest or the sudden cardiac arrest as well as the heart attack.
Mm. Mm. Right. Yeah, I mean, you mentioned there, I mean, few of the most important factors like sugar, right? I mean, basically the diet part of it. What we can control is the diet part, right? So,
Yes.
sugar, junk food, and all those. So, out of these,
The cholesterol levels.
yeah, right. Cholesterol levels, right? So, out of these, I mean, do you do you recommend? I mean, obviously, you will recommend them changing their diet, but how much percentage of these people are taking these kind of diets today and that come to you with these problems?
So
Any?
many of the patients we see they are chain smokers, the diabetic, uncontrolled sugar, uncontrolled cholesterol level. They
Mm.
definitely have the underlying like their food habits are not good. Okay,
Mm.
they are morely rely on the fast food and junk foods, which are not healthy as such.
Mm.
Okay, and definitely what you eat, it definitely goes to the body and body will degrade it. Okay, if you are eating healthy food, okay, the uh, it will give the healthy nutrients, the multivitamins, the minerals to your body. If you
Mm.
are eating the junk food or the unhealthy food, definitely the adverse effect your body is going to suffer from.
Right, right. Yeah, so I mean, obviously, I mean, the junk food and ultra processed food mostly, I mean, we should avoid, right? So, what are your recommendations based on, I mean, this unhealthy lifestyle and stress? I mean, how to manage our diet, our food in our day-to-day life? What will be your recommendations?
Okay. So the food and diet along with the nutrition, it depend on the patient's professions. Okay. It should be tailor-made. Okay. It depend on the how the person is, what is his day-to-day activities, um, what is his age, what is his sex, what is his BMI, what is his weight.
Mm,
Okay.
mm,
So depend on that. We have to treat it one patient to
right,
other patient and
right.
specifically cater that patient. So, but the in the nutshell, what we can say, have good healthy breakfast.
Mm,
Okay. Timings of your breakfast, lunch, and dinner should be fixed. Okay. You
mm,
can vary it around 15-20 minutes. That is okay.
mm,
Uh, Along with that, you should include the fiber rich diet. Okay.
mm,
Good healthy salads. Okay.
mm,
Avoid eating late night. Okay. Okay. As you should finish your dinner by max to max 8 or 9 p.m. Okay.
okay.
Not more than that. Okay. You should fix your lunch timing as well. Okay. Try to avoid as spicy and oily foods. Okay. Specifically at night. Okay.
Mm,
Then along with that, you need at least exercise, some exercise. Not you are not supposed to go to the gym for if your time management is not that much good, or you are not your time is so much busy, but
mm,
at least brisk walking, running, cycling,
mm,
okay, swimming, this should be there at least four times a week. Okay. Along with the healthy diet, your body should be active.
right.
Okay. You should be fit, physically fit.
Mm,
Fit diet and fit physically fit body, definitely it will have a good outcome. Okay. You will not attract such mm, what we can say lifestyle diseases.
mm,
Which are the lifestyle diseases? The hypertension,
mm,
the diabetes, the ischemic heart disease, the stroke as well, brain
mm,
stroke. These are the lifestyle diseases.
mm, mm. Right. I mean, especially, I mean, with the IT people, right, who have desk jobs, they can do at least walking, say, for 1 hour every day or 30 minutes every day, right? That should help.
Yes.
Right.
You can
Okay.
climb the stairs as well in your office. Avoid using lifts. Okay.
Right.
Try to go for a brisk walking after lunch for 10-15 minutes.
Right.
Okay. Try to avoid as much coffee as possible in the offices. These are small things, but it has a large impact in long run.
Right. So, just taking that example of climbing stairs, right? So, I mean, sometimes the heart rate shoots up, right? And someone may complain of chest pain, right? In that situation. So, I mean, chest pain could be anything, right? I mean, it could lead to various reasons. But what is the recommended heart rate that you, I mean, recommend when you exercise? I mean, is it between 100 to 120 or a little
Okay.
bit more than that?
So this also depend on the patient's age as well. Okay.
Okay.
For the old age, this may not be very much high, but in the young age, okay, those who are athletes, those who are used to have the higher heart rates or
Mm,
something.
mm,
So generally 120 to 120 to 125 is the maximum heart rate you should achieve. Okay.
okay.
But sometimes you don't know no, what is heart going what is your heart rate going on. Okay.
Mm,
So
mm,
whenever you feel palpitations, you can feel your heart rate.
mm,
When you feel dyspneic, you feel breathless, you
mm.
feel uncomfortable, you feel sweaty, you
Mm.
just stop it. Okay. You
Okay.
just stop for some time, take a break, and then again you can restart.
Right. Right. And if the problems persist, then they should obviously consult a doctor, right?
Obviously,
Because
consult the doctors, rush to the emergency,
mm,
take your ECG, rule out the life-threatening things first. Okay.
mm,
There are many reasons, as you said, there are many reasons for the chest pain, like muscular chest pain as well.
mm,
Okay. It may be heart related, it may be lung related, it may be bone related, it may be infection related. Okay.
mm.
It may be anything. But
Right.
what kills first is the heart attack. So just
Mm.
rule out it.
Yes.
Rule out it. The rest of
Definitely.
the things can be taken care of.
Definitely. So doctor, I'm going to share some of the highlights that you had sent me through WhatsApp on some cases that you have shared, right, where you have helped patients, right? So let me share my screen quickly so that our viewers also can see it and they can understand what's the problem here, right? So here you can see you have shared a clip where it says, and this is from a leading newspaper, a doctor's prescription for road safety. So this I think is your article, right? I'm just
Yes.
going through. So help us understand. So this was city doctor rescues patient stranded in Himachal Pradesh. This was some kind of calamity there that happened.
Yeah, last year there was a calamity at Himachal Pradesh. As you
Mm,
know, there are many lives who succumb to death. Okay, so I was there for a tour. Okay, in
mm,
Spiti Valley.
mm,
So me and along with me, there are 300 tourists were there who were stranded at the Himachal Pradesh. Okay,
mm, mm,
there was a severe rainfall at the base, and we were at around 1200 feet at height.
mm,
There was a severe snowfall, and we were stranded there. There was no food, nothing was there. There are
mm,
many old patients as well. Okay, so many of the patients who had the feet like the epilepsy attack.
mm,
Okay, those who were asthmatic, they started feeling dyspneic. Those were heart patient, they also feeling chest pain and uh, breathlessness as well.
mm,
So the government of India sent the air ambulances like this the Air Force helicopters.
mm,
So I saved such patients there. Okay, I shifted that patient to the nearest Shimla medical colleges.
mm,
Okay, um, I give them the primary treatment over there, applying the oxygen, giving medications, giving injections, the nebulizations as well.
mm.
Okay, being a doctor because I was the only doctor among them. Okay,
Right.
so many of the patients, I think three or four of the tourists' lives were saved at that time
Mm.
because we standed there for around 10 to 12 days.
Wow.
Okay, there were no food, no network. Okay,
Mm,
the oxygen saturation in such height is very low.
mm.
Okay, so in such patient, keeping yourself alive is also the one of the challenge.
Right, right, right. So, I mean, these guys, I mean, all these people must have been very lucky to have you there, right? So, this is another such incident where you have shared where Oman-bound Bangladesh flights makes an emergency landing in Nagpur. So, some gentleman here complained of heart issues, or I mean, if you could
Yes,
explain
yes.
this condition.
Yeah. So this was in the Bangladesh flight. Okay.
Uh-huh.
The patients suffered sudden unconsciousness. Okay,
Mm,
followed by the chest pain and some movement. There was a rolling up eyeball. Okay, and he felt unconscious. He was a 33-year-old male patient. Okay,
okay.
so for that patient, the emergency landing of that flight was taken at Nagpur International Airport,
Mm,
and patient was shifted to our Kingsway Hospital in the emergency department.
okay.
Uh, when he came, the oxygen saturation was very low, the blood pressure was very low. The
Mm,
ECG has some changes, okay, and as he was unconscious, we also did his MRI brain. There was some changes in the MRI as well, okay.
mm,
So he was admitted. He was managed very well, and we also discharged this patient after 3 days. Okay, he walked home.
okay. Okay, great. Yeah, I think I mean I understand your profession as a critical care person is very tough, right? And it's a very demanding job, right? I guess you have to be available 24/7, or is there any fixed timings?
All the doctors has to be available on phone at least on 24/7. Okay.
Uh,
Uh, Whenever there is a emergency or there is a help required, we supposed to rush to the emergency.
Mhm. Right. Yeah. So, doctor, help us understand. I mean, in case of such physical, mental traumas that you deal with every day to day, right? How do you deal with the family members? How do they react? How do you help them cope up with this situation?
So that is very good questions. Okay. So counseling the family members, those
Mm,
who are in shock. Okay. Because for them, their patient was very well when he left the home in the morning.
mm,
Okay. For the office or for any work. Okay. And right now he is landed in the emergency,
mm,
lying on the bed, having oxygen, having multiple needles in the hand, having IV fluid or multiple injections going on. He is supposed to admit it in the ICU, in the critical care management, or undergoing some major operations. So, counseling such patients' relative is a difficult and challenging job. Okay, first we try to settle them down. Okay, uh, we counsel them in a calm and silent zone. Okay, we let them understand the critical phase of their relatives. Okay, what is going on? We generally show them the CT images, CT scan images, or the UHG images, or the ECG, whatever may be. We help them to understand what's going on, what the treatment is going on. Okay, what what is the next line of plan? Okay, what is the management plan will be? How much days he has to be in the hospital, the expected length of stay in the hospital. These are the things, and then we open for the discussion. If they have any queries, okay, they can ask, and those if we have the answers, okay, we tell them the answers. If we don't know the answers, we tell them, keep right now we don't have the answer of these questions,
Right.
and we'll definitely, as soon as the blood reports or the any report is pending, we'll let you know.
Okay. Okay. So in cases where there is, say, sudden cardiac arrest or, I mean, unfortunate death due to heart attack or stroke, right? So in those cases, does defibrillator works, or, I mean, are you able to revive the patient in some cases?
Yes, yes.
Okay.
So actually, I forgot to share one case with you also.
Mhm.
So not in the stroke, but in the heart attack. Okay, those who have the ischemic heart attack, in that patient, definitely there is arrhythmias like ventricular fibrillation and the ventricular pulseless ventricular tachycardia.
Mm.
Okay, like when the rhythm of the heartbeats are deranged. Okay, it's not regular.
Okay.
Okay, there is chaotic movement, chaotic rhythm in the heart. So
Mm.
in such patients, we require defibrillator. Okay, defibrillator is giving shock to the heart so
Okay.
that we can stun the heart for a moment, and so that heart can restart its rhythm. That
Mm.
is a basic mechanism behind that. Okay,
Right.
generally to 150 to 200 joule current we generally give to the patients. Okay, and that has saved many life.
Mm.
Okay, that has saved, I have saved many life by using the defibrillator. Okay,
Okay.
it's a wonderful device. Okay, you just know how to use it and when to use it.
Okay. Okay. So during emergencies, when ambulances are called at home, right? Are the ambulances also equipped with the defibrillator, or it's only given at the hospital?
Yes, yes. No, no, they have. There are two types of ambulances, the ACLS ambulance and the BLS ambulance. The BLS is a basic ambulance. Okay.
Okay.
In the ACLS, there are all the cardiac equipments are there. Okay.
Okay.
Including the defibrillator, including the intubation, the small ventilator as well.
Hmm.
So these kind of ambulances are equipped to save the life.
Okay. So during such situations, I mean, we should always call the ALS ambulance, right? I mean,
ACLS ambulance,
right.
acute cardiac life support ambulance,
Okay.
ACLS. Yeah, that we
Okay.
have. Yeah.
Got it. Got it. Yeah. So, doctor, I think you are pressed for time. I know you. I mean, you have a lot of work to do, and thank you so much for giving us your precious time today. It's a Sunday, yet you, I mean, gave us the opportunity to talk to you and share your knowledge. So, thank you so much, and we hope to have you back again whenever time permits.
Thanks for inviting. Thanks. It was a pleasure talking to you. Thank you.
Thank you, Dr. Rupesh. So, and thank you to all the viewers for watching. Please do like, share, and comment on our podcast, and also do subscribe to our channel. So, until then, stay healthy, stay fit. Thank you so much for watching.